Hello everyone, and welcome to the 20th session of the Journal Club, which is organized by European Journal of Cardiovascular Nursing. My name is Eva Goossens, and I'm affiliated with the Academic Center for Nursing and Midwifery at the KU Leuven in Belgium. And I'm going to be the moderator of this session today. I'm very pleased to be joined by Mariela Acuna Mora, who is a joint PhD student at the KU Leuven in Belgium, but also at the University of Gothenburg in Sweden. Mariela is the lead author of the paper entitled Patient Empowerment and its Correlates in Young Persons with Congenital Heart Disease, a paper which was recently published in the European Journal of Cardiovascular Nursing. So to kick off, I would like to begin by asking you, Mariela, to give a short introduction to your paper.
Well, hello, Eva, and hello to everyone that will be looking into this journal club. What we did was a multi-center cross-sectional study that included young persons with congenital heart defects between the ages of 14 and 18 years. And as part of the questionnaires the adolescents were asked to answer, we had one measuring patient empowerment. So in this paper, we're mainly focusing on patient empowerment and its association with other patient-reported outcomes.
Okay, so could you explain to us what the main research question was that you addressed in this study?
Yes, it was two-folded. On one hand, we aimed to assess the level of empowerment in young persons with congenital heart defects. And on the other hand, we wanted to investigate which patient-reported outcomes, like, for example, illness perception or transition readiness or patient-reported health, were correlated with the level of empowerment in this particular group.
And could you briefly summarize how you designed the study?
Well, we used a cross-sectional study design, and we included, as I said before, young persons with a confirmed congenital heart disease diagnosis between the ages of 14 and 18 years, and that were also at the time under follow-up at one of 4 pediatric congenital heart disease centers here in Sweden. We had 593 young persons eligible for inclusion. And what we did is we sent them a survey package that included information about the study, informed consent, and also a set of questionnaires. We got back 202 completed set of questionnaires, and in order to assess potential correlates, we did univariate and multivariate linear regression analysis.
Okay, so the central concept of your paper was patient empowerment. But I was wondering how we as nurses, healthcare professionals, but also researchers should actually understand this concept.
Well, patient empowerment, it's a concept that I think we have all used at some point, but that we maybe don't really know all that it implies or use it as a synonym for other concepts. Patient empowerment is both a process and an outcome. And when I talk about a process, it's because it requires that we communicate with the patient and relinquish power in the care relationship. And it's an outcome because it entails the person becoming more autonomous, having a higher level of control, and it's also a person that is able to manage their condition. We usually work with the definition of empowerment from Small and colleagues, and they also propose that empowerment is comprised by 5 dimensions, which are knowledge and understanding, personal control, shared decision-making, identity, and enabling others.
Okay, so you investigated patient empowerment in a fairly young sample of adolescents. Why is patient empowerment so key for young patients with a chronic condition like, for example, congenital heart disease?
Well, I think adolescence is a time to support the young person, right? And this support should involve, among other things, the fostering of development of psychosocial skills such as patient empowerment. Empowered young persons are the ones who will actively participate in care, which entails seeking information, participating in the decision-making process, and making themselves heard. Furthermore, I think that they are aware of the different influencing factors that affect their condition and then can prioritize the required actions to improve their quality of life and well-being, and also acknowledge when is it that they need assistance from others, whether it's their parents, friends, or healthcare professionals.
And what were the most important findings from your study that could be quite relevant for daily nursing practice, for example?
Well, we found that our group of adolescents had an empowerment score of 54 from a range between 15 and 75, which is a first within a group of adolescents. So this can be used in future comparisons with other chronic conditions and also other studies, including congenital heart defects. Regarding the correlates of patient empowerment, we found out that individuals who had a higher transition readiness and who were able to communicate with fewer problems were associated with a higher level of empowerment. These variables were also significant for the 4 subscales of empowerment. While working clinically, I think that we could make use of these results by trying to improve the skills. So we're talking about transition readiness or helping young persons communicate with the healthcare professional and also others much better.
When I was looking into your paper, you make use of a very original graphical visualization, actually, for empowerment, but also the 5 subscales. And the technique is used a violin chart, or a plot. Could you briefly explain to us how we should interpret such a figure?
Well, thank you for thinking that it was original. A violin plot, it's a combination of a traditional box plot and a density plot. So the density part of the plot, it's actually the color area that you will see where like the purple, blue, and green colors, and they're representing the distribution of the scores. The broader the plot, then the more people were having that score. So for instance, if you look into personal control, you see a heavy emphasis on the scores 14 and 15. This means that most people score this high. Whereas for identity and enabling others, on the other hand, that distribution of scores is more distributed over the range of scores.
Okay. And so one of the findings from your study was that a higher level of transition readiness in patients and having fewer problems in communicating about the illness were actually significantly associated with higher levels of empowerment. How can we integrate these findings into, for example, transition clinics or programs that we see now and then in hospitals for adolescents with chronic conditions?
I think that by implementing certain strategies that lead to more involvement in care and to a gradual transfer of responsibility to the adolescent, because I think we're all very much aware that most of the time it's the parents the ones that are having this major responsibility. Just thinking about, for instance, allowing the young person to attend hospital visits by themselves, to establish goals before each visit related to their care management, and to evaluate how did it go, or even by using already existing tools such as the shared decision-making model.
Okay. And furthermore, you also found that patients who had a higher level of transition readiness also had a higher level of knowledge or understanding of their disease. So I was wondering, would this be called like, would we have to interpret this result as a call to invest more time and energy in providing patients with education?
I think that patient education is an essential part of transition and transition clinics, if we're to discuss that. I think that if we want young persons to make informed decisions, then we need to provide them with the information, but also guide them on how to identify the right sources of information. However, I do think that we need to reconsider how we deliver the information and how we actually confirm that the young person has understood the information that they have received. We all learn in different ways, and if we want to actually increase their knowledge and understanding, then we need to spend some time identifying the ways that each particular adolescent prefers to learn. Otherwise, I don't think we're really able to increase that knowledge and understanding.
And which instrument could healthcare professionals such as nurses or researchers use if they want to measure the level of empowerment in patients?
Well, we actually developed an instrument that measures patient empowerment. It's called GIPES, and it stands for Gothenburg Young Persons Empowerment Scale. And when we developed the scale, we actually had in mind that we would like the scale to be used clinically. And that is partly why we try to keep it as short as possible, but without compromising the measurement of the construct. GIPES includes 15 items that are measured in a 5-point Likert scale. And it has been validated in persons with congenital heart disease, but also type 1 diabetes. And it is currently being used in several studies with participants who have other chronic conditions. If you were interested to measure certain skills such as patient empowerment in clinical practice to determine which areas need improvement. I think guides is a good instrument to have at hand. It is short, and you can calculate the score quite fast. And by analyzing the individual items, you can identify potential areas of improvement.
Okay. And Mariela, could you address some of the methodological limitations or considerations that we have to keep in mind when we are reading your article?
Sure. I think that the first aspect that you should keep in mind is that we use a cross-sectional study design, which limits our analysis and the possibility to establish causality in the relationships found. However, we are currently undertaking a longitudinal study that will help us assess these correlations in more detail. We also had a low response rate, given that from 593, we got 202 responses, despite the best efforts from our collaborators and the fact that we sent the questionnaires by post could have also not have been the best approach considering our target group. I do think that, well, despite our limitations, we were able to undertake a multi-center study and had a set of instruments that had been previously validated in your persons with chronic conditions, which are definitely strengths to keep in mind.
Okay. So to finalize our journal club of today, what would be the overall conclusion of your paper?
Well, I think the overall conclusion will be that transition readiness and communication were associated with patient empowerment, as well as with other dimensions of this construct. I think that the interaction between these variables can lead to increase the young person's preparedness to navigate adult care, develop their capacity to communicate with a healthcare professional, and also eventually to become active partners in care planning.
Okay, so thank you for your attendance and for responding to our questions.
Thank you.
I hope to welcome you at the next Journal Session Club in the future.